session, I'll turn it over to the wonderful Laura Hurwitz to get us started.
Thank you, Michaela, and good morning, everyone. We're so happy to be here with you today. As Michaela mentioned, I'm Laura Hurwitz, and I am the project lead and a consultant to the School-Based Health Alliance on the School-Based Health Alliance's Pediatric Mental Health Care Access Initiative, and I have the pleasure to welcome you to today's presentation. And it's now my honor to introduce our two speakers, my colleagues of mine, Jill Bonenkamp. Jill is the Associate Professor of Psychiatry at the National Center for School Mental Health, which is one of our partners on this project, as well as Katie Trainer, who's a lead clinical research specialist also at the National Center for School Mental Health. So you'll be hearing from them momentarily. And I also just want to acknowledge our small team on this project, Katie Stinchfield, who's now consultant to the School-Based Health Alliance as well, and the former director of mental health at the School-Based Health Alliance, and Michaela Riven, who's the program associate on the project. Thank you both for being here today and for supporting this work. So what we're hoping to accomplish today is for you to understand both opportunities and considerations for PMHCA programs to expand their reach into schools. We know this is exploratory work and that PMHCAs are beginning this expansion. And hopefully today you will learn about some ways that this has been happening, and specifically steps to assessing your own readiness and to effectively engage with these new audiences at school and district level, and also to become knowledgeable about some resources available to support you on your journey. So the agenda today, I'll give you a very, very brief description of the PMHCA initiative, and then you'll hear from Jill and Katie about the landscape of mental health in schools today, considerations for expanding your programs into schools, ways to assess readiness and capacity, to learn about some actual opportunities, to consider training school health, school audiences and best practices for that. And finally, as I mentioned, resources and also some upcoming events that the School-Based Health Alliance has with regard to expanding not only to schools, but of course, school-based health centers as well. So why is there this expansion? We know that increasingly students are being identified for school mental health issues in the school setting, as well as actually receiving services in the school setting. The school mental health has risen to a crisis point, which has really been exacerbated by workforce shortages of school mental health providers and mental health providers, and specifically child psychiatrists. PMHCAs have proven to be a possible strategy to mitigate this crisis. And so today we acknowledge that schools are a setting in which that can possibly happen. The School-Based Health Alliance was funded by HRSA through the Bipartisan Safety Act and to build the capacity for PMHCAs to explore this new setting. And so this webinar today is one of several activities that the School-Based Health Alliance is sponsoring to build the capacity of the PMHCAs in these new settings. And so in addition to this webinar, you'll be hearing about a document that will go into further detail around this topic, but today is just the beginning of this conversation. So I will now turn it over to Jill to walk you through that.
Great. Thank you, Laura. And good morning for most folks across the country, earlier for some folks than others. We are thrilled to be with you today. Thank you. We're just thrilled to see so many folks who have joined us today. Thank you so much for already writing your name and organization in the chat. We are thrilled to see folks from California into the middle of the country in Missouri, and then across over to the East Coast. We would love for you to share something enjoyable that you did this this summer, in addition to your name and organization, if you haven't already put that in, as we kick into this busy time of year, and especially when we think about schools and going back to school, making sure that we're harnessing good things that happened this summer as we carry on in this work. So looking forward to seeing some of those things come in. I always appreciate having some ocean therapy, which I got to have some of this summer. So as you're putting those in, let's see, we got folks already putting in some good things coming in here. Ooh, paddleboarding, amazing. Sea turtles hatching, oh my gosh, that sounds awesome. Vacation with sisters, oh, family time. That's I think one of the most amazing things, right, is getting to be able to take a little bit of break time. I see with grandmother, with grandkids, with kids, and lots of good outdoor activities. So please, oh my gosh, and the Taylor Swift, that's awesome. I'm jealous of that one. So as we're moving into the year, keeping those close to us as we think about moving forward with, for some folks, perhaps new areas of this work, and for others have already engaged in this. So please keep those intros coming in. And because we have such a big group on this call, we're really excited to hear more about your current experience expanding your work with school audiences. We recognize that we may have folks who haven't considered it, but saw this webinar and said, sure, let me see what other folks are doing or what we might think about. And I can see some names on the call that I know are leading this work and have specific partnerships with school audiences. So we're going to pop a poll up here so folks can let us know where we are, and so we all can kind of get a sense of where we are here. All right, and I see those coming in. Excellent. Great. And we'll publish them in just a second when we have more of these complete here, but I'm seeing a range here. Certainly some folks on the call who have not started this work yet, and many folks, looks like a majority here, who really already have some specific partnerships, which is fantastic. And so I believe folks can go ahead and see our poll here that it looks like the majority of folks on our call. So we've got 33% who have begun outreach to school audiences and 47% that actually already have a specific partnership. But don't feel alone if you're in this work that you're just starting, and please feel very encouraged that you've got a wealth of knowledge in your community of practice with other PMHCAs here on this call. So knowing that we have this wealth of information and wealth of expertise on the call, we would like to wholeheartedly encourage you to chime in throughout this. I'll have some specific times where we'll ask for folks to share what their experiences are, but please feel very encouraged to share at any time questions you have, but especially expertise or experience that you've had reaching out to schools. We saw questions come in the beginning where folks had asked, how do we get connected to schools? Or, we've tried getting this started, but don't know exactly who to connect with. So we welcome you all sharing your expertise throughout the webinar. All right, thanks everyone for participating in that. And so as we're thinking about our mental health work, and something that we often do when we are working with school audiences, is we are increasingly trying to make sure that we are having an experiential introduction, and making sure that we as professionals are modeling what we're telling our school teams or our pediatrician teams to do, and giving us some time ourselves to really ground ourselves. So with that, I'm going to turn it over to Katie to give us a mindful moment.
So much, Jill. So as Jill mentioned, we really want to make sure we're practicing what we're preaching in terms of using these skills that we're wanting our clients, our schools, to be using. So if we go to the next slide, we're just going to do a brief mindful moment to kind of help everyone to center, become calm, and be able to enter fully into this webinar. So Jill, if you could go ahead and press play. I think we might need to share sound.
Thanks, Katie. I'll stop my share for just a second here so I can make sure y'all can hear this nice relaxing sound coming through.
As we get that queued up, just invite everyone to, maybe close your eyes, take a few deep breaths. If you're, toggling between emails and everything, just maybe put that down for just 1 second as we take a brief 1-minute meditation.
Close your eyes, and we'll take a few moments to calm your mind and body. Soften your face, your neck, and shoulders. Do your best to fully let go. And turn your attention to the breath, the calming breath, the soothing breath. Take long, slow breaths, full and deep. Breathing in, I am calm. Breathing out, I'm at peace.
Thank you so much.
Thanks, everyone. All right, and Katie, I'm just going to see if I can get a thumbs up. You can still see my slides, okay? All right, great. Thanks, everyone. Okay, so as we're getting started thinking about what might be the role of your PMHCA team as you're expanding to school audiences, we want to give you an overview of mental health in schools and also give you some resources of where you might go for more information. So this is going to be our about 7-minute overview of mental health services in schools. We could probably do a day-long session on this, but we want to give you a landscape of this to get started. And so, as Laura talked about, we're preaching to the choir. We don't have to share with you our really dire statistics around mental health concerns and the mental health crisis that we're seeing. And schools are feeling this greatly. And so, we know that these statistics, school systems are seeing and feeling these statistics every day. This is risen to the level of an every other student is having a mental health concern or is having this crisis happening. And so school systems have been doing mental health work for many years and for decades, but really now we're saying we almost can't do our mission unless we're addressing this. And so this is important to know that school systems across the country are really saying this is a #1 priority that we're thinking about how do we address and support and also have been doing this work and have many systems in place to be moving this forward. So we wanted to share, a bit about why mental health services in schools. And one piece of that is, of course, this growing need that school systems are saying that really we can't even get to the business of what we need to be doing in the classroom unless we have a way to address this. But they've been thinking about this for decades, and we have decades of data and evidence that when we're doing a multi-tiered system of support or mental health promotion, prevention, and intervention in school systems that we see better academic outcomes. It improves access to care. We see better early prevention, early identification and intervention, and that our overall school climate and safety is better, and this continuum of great outcomes that we know when we're doing this work in schools. So when we think about when we say mental health in schools, or what we refer to as a comprehensive school mental health system, what does this mean? And so here I have the core features of comprehensive school mental health. This comes out of a wonderful guide that is about a 7-page overview that we'll link to at the end. Is a great place to get additional details. But when we think about a comprehensive school mental health system, it is a multi-tiered system of support, so mental health prevention, promotion, and intervention, that focuses on well-trained educators and specialized instructional support personnel. Those are folks who are employed by the school system, thinking about school psychologists, school counselors, school social workers. That's just the beginning point of folks that are school employed, in addition to community partners. And those are community partners like community behavioral health agencies, as well as our wonderful school-based health center partners. And in short, there are lots of folks at the table, which we'll talk more about. When we think about best practices in comprehensive school mental health, we're thinking about a family, school, and community collaboration. We're assessing for what are the needs of the school system and resource mapping, using data, making sure we're using evidence-based and emerging best practices, and considering how do we fund these systems of support. So when we think about a multi-tiered system of support, or a comprehensive school mental health system, I want to dive just a little bit deeper about what this looks like. So this includes, and our school systems often use this term multi-tiered system of support, or you may hear the term MTSS. For folks who are familiar with this triangle but know it under the public health triangle framework, that is absolutely the same thing. Our idea here is that we, at Tier 1, we want to make sure that we're promoting positive social and emotional and behavioral skills and overall wellness for all students. And I'll flag for all students and staff that when we think about comprehensive school mental health, this is for every person in the school community. As we move up, we think about tiered support, so early intervention for students identified through needs assessment, and targeted interventions at Tier 3 for serious concerns. And on the next slide, I'll show you some examples here of what might that look like in the school community. So at Tier 1, things that might be happening for all students might include focusing on school climate and interventions that focus on school climate, trauma-informed practices, mental health literacy, social and emotional learning, or a focus on staff well-being. As we move up to Tier 2, this might include screening for mental health concerns, group well-being check-ins and interventions, and psychological assessment or individual therapy or mental health crisis intervention. So when we look at this triangle, we may say, wow, this is a lot that's happening in schools. Do all schools have all of these things in place? And I want to flag that in many ways, this is aspirational, that school systems across the country are really driving towards having this full continuum of mental health services and supports in schools. And many are getting close to having this, to having Tier 1 and Tier 2 and Tier 3 supports, but they certainly don't have everything listed on this slide, and nor would we expect to. But we wanted you to have the range or the umbrella or the sort of the world of what schools in your communities may be already have in place at different tiers, or maybe thinking about having in place, and to start to, for you all to think about what might be areas that you can support them in this work. And I know we have folks on this call who have begun to help to support school systems at these various tiers. And so please feel free at any point to chime in and say, yep, we've been working at Tier 1 and have been helping with social and emotional learning, or we've really focused our work on Tier 3. We would welcome you sharing your expertise piece. So as I mentioned, we've got lots of folks who contribute to this multi-tiered systems of support. So there are many folks who are employed by the school system who are part of the school mental health team. You can see this long list here. I listed some of those. Our school nurses and school health professionals are key members of this team, as are educators, our principals, deans, attendance officers, and teachers who are leading this work, in addition to those specialized instructional support personnel. I list a lot of folks here, again, as we were thinking about on that last slide, that not all schools have all these positions, but we want you to have this umbrella of, you could ask about, who leads this work in your school community, in your district, in your state. This can look really different in different states. This can look really different in different districts, and even within school districts, each school might do this differently. We also want to flag all of the folks on the school-based health center team who may also be contributing to the school mental health team. You can see that there are many folks here who may be working closely in partnership with the school system to be able to provide that multi-tiered system of support. And so I hope this is starting to get the wheels spinning around, okay, we could ask, do they have partnerships with school-based health centers who are contributing to mental health? Who are the folks perhaps in the community that are leading this work? And really just wanted you to have this sort of full overview of, when we think about what might be happening in school communities, that this is an overview of what this looks like. So I'm going to pause for just a second here and see. Great. Thank you so much, Dana, for chiming in. So within our county and city, our agency is at tiers 2 and 3. Excellent. So please continue to have those pieces coming in. And before we dive into opportunities, I want to pause so we can have some time if folks have questions about comprehensive school mental health or anything that we can answer about that. So I'll be quiet for a second and please feel free to put those into the chat. So Michael shared that they're in all 3, but primarily in 2 and 3. Excellent. Great. So we're seeing lots of folks saying, mostly at this tier 3 mental health intervention, and then love hearing this work around helping to build infrastructure. Tons of opportunity there, and especially when we have this great mental health need, that the more we can do on that side of helping school systems is great. Yep. Okay. And hearing some that there's no one to send tier 3 kids to, and that school staff need more support at that tier 3 area. So keep this comments going in the chat. I know personally it feels so helpful to not feel alone in this work and know that other folks are navigating this. And so we welcome you to continue that dialogue going. And know that this is your network, right? We want you to take this beyond just this webinar today. These folks are doing the work alongside with you. So please feel very encouraged to include your email, make a connection, write down someone's name that you want to make sure that you connect with in the future. So why expand into schools? I saw a why not expand into schools. We know the case here. You have the data to move this forward. And so in addition to that, need, we want you to think about those opportunities that exist. And so we'll first talk about some big buckets of potential opportunities, and then we'll get into more specifics of making those connections and fostering partnerships with school teams. And as we're talking about the opportunities and considerations, we want you to be thinking about way back when you started this work, how did you make those connections with your pediatric primary care teams and some of those early processes of learning the culture of what worked best, commonalities across practices, but also differences? And that those lessons and models absolutely apply to schools, right? We've tried to give you a landscape and an overview, and we'll give you considerations generally about schools, but just like in your work with pediatric primary care, that every school community is going to have its own specific things to think about and consider. And probably most important is learning that and figuring out the best ways to partner. And we've seen folks who are doing that work early have great successes in that. And we'll talk more about that as we move forward. All right, that's enough of me talking now. I'm going to turn it over to Katie to move forward on some of these big buckets of potential partnership.
Thanks so much, Jill. And I'm seeing some questions coming in the chat that are really helpful. So we'll try to address those throughout. But also, if you have an answer for one of the questions in the chat as a participant, please make sure to enter that in there. And some of the questions I'm seeing are about that partnership, about kind of linking the pieces together. And one of the first opportunities we really wanted to highlight was the opportunity for PMHCAs working with school to expand and link those systems of care. So schools present an opportunity to expand systems of care by serving as an access bridge between families, between the home, and other services, such as primary or specialty care, community mental health providers, or other social services. And PMHCAs really have an ability there to help connect families to medical and mental health services more directly. And the schools also provide a natural environment for referrals. Teachers and other school staff can help identify youth mental health needs, presenting an opportunity to really streamline the referral process across systems so that children can access needed services sooner. And so by partnering with schools and districts, PMHCAs can really help remove some additional barriers to care for providing that direct line of service for mental health provision, and by connecting schools to those primary care providers, which I know was a question that was asked in the chat. And so that might involve, setting up some agreements, making sure that there's data sharing, that is, thinking about both HIPAA and FERPA. So it might take a little bit of logistics, but there's an opportunity to bridge that care there. There's also an opportunity to, leverage existing partnerships with community mental health agencies or strong relationships with primary care offices. Those relationships might be relationships that the PMHCAs have that can bring to the schools, or maybe a school or a district already has a relationship established with one of those providers. So schools with school-based healthcare centers on site can be providing services in the buildings, and moving towards a more integrated system of care can help to decrease the time between identification of need and then the utilization of those services, which is going to lead to better outcomes for youth and families, and also better outcomes in the schools themselves. We also want to see how PMHCAs might be able to support screening in the schools, both at the universal level and also at the targeted level. So we define school mental health screening as the use of a systematic tool or process to identify the strengths and needs of students. So some schools and districts might be utilizing universal screening, which involves screening an entire population, such as the entire student body, or a small subset of a population, such as a specific grade level. And while universal screening uses established tools, it's not designed, nor should it be used, to be a diagnostic assessment. It might just help to give some indication of some patterns. And there's also a lot of factors to consider when a school or a district might adopt universal mental health screening. So not every school is going to be using that. But we can also think about clinical or targeted screening that involves the use of validated tools to screen youth at risk or already displaying some mental health concerns. These tools may screen students for the presence of specific mental health concerns and may be used during the referral process or as a follow-up to universal mental health screening. So PMHCAs might support, could you go back, Jill? Thanks. Might support universal mental health screening by providing that expert consultation for the screening process. They might help to assist in the selection of validated and appropriate tools, either at the universal or the targeted level, and can also provide training to staff on mental health literacy, on the use of screening, on identifying specific mental health concerns, so that the staff can really support that referral process. The PMHCAs can also help support staff in using data-driven looking at the data receiving from either universal or targeted screening and helping them to sort of make the decisions about what level of services students might need, when they need to refer out, who can we be partnering with, and kind of that whole systemic aspect of it. And lastly, we wanted to highlight how PMHCAs can help to build the capacity of the mental health workforce in schools by providing the 3 pillars that y'all are already providing: consultation, training, and resources and referral. So building capacity means increasing the knowledge and skills of the providers in the schools, as well as their ability to meet the needs of students in their school. Now, this doesn't mean that the school-based providers will be meeting every student's needs specifically themselves, but we're hoping to provide the providers with the knowledge to kind of triage support. And so consultation might look like providing consultation to providers on complex cases, or building their knowledge and their ability to handle those things in the schools, or systems level consultation. So helping to build out the mental health system in a school. Training might look like training on specific evidence-based practices, training on mental health literacy, increasing the staff's knowledge on what to look for so that they can refer students more easily. And then also resources and referrals, resources to support mental health of students and staff, and then referrals to help streamline the referral process to professionals in the community.
So I am seeing awesome questions and sharing happening in the chat. And so as we're moving into assessing readiness and capacity, I want to highlight some of those things and encourage that. So I see lots of questions and then responses back around, are you reaching out at the state level? Who are the folks at the state level that you're connecting with? Or are you reaching out to individual schools? And I see responses happening that folks are doing both, which is awesome. So some amazing, feedback here, folks saying that they have worked with their Department of Health or mental health at the state level. We see folks saying that they have also helped PCPs to think about doing those individual connections at the school level. I see Missouri sharing that they've been working across, multiple levels, thinking about both at that local, regional, and state, and shouting that out, knowing that we've got a great expert in Melissa Maris in this work in both PMHCA and also school mental health work. And so please continue these questions coming in, and please continue sharing what you've been doing, because as we've said, this is going to look different for each state, but taking some nuggets of what other folks have done is really going to be helpful in terms of making those connections. And I would say yes to everything that folks have said coming in. Yes, connect at the state level. Yes, think about connecting at the local level, and everything in between. Okay, so I hear everyone off to the races in terms of we're making connections, we're thinking about how we do this, we're thinking about what we might to connect. But I'm going to move us back one step as we think about sort of what, as a PMHCA, do you need to do to be ready for school extension? And as you're thinking about these tiers of support and this need and making these connections, making sure you're having time to think through what are our goals specifically for reaching out to schools, what funding and staff and time and expertise do we have to do this work, just as schools and pediatric primary care have different levels of support and expertise. We know that your teams do as well. And so do you have some dedicated staff that may be especially in a place to be able to do this work? What exactly do you want that to look like? Do you want it to be more on a local level, or do you want it to be more at a state level? and thinking about, which ways you can connect with school mental health champions who can serve in an advisory role, either in your state or at the local level. So making sure you're taking time as a team to have this reflection time, not only for what schools need, but what you may be able to provide and how to set up the infrastructure to be able to do that. So thinking about how might you do this more specifically. So thinking about a vision for your school expansion, we encourage you to actually write this down and get really specific about this. Think about some of the folks that people have put in the chat around state partners who are also potentially doing work and mental health work in schools. Beginning your process of identifying stakeholders and collaborators, and then starting this process of what do schools need? I saw some great things coming in the chat that they were really saying they need tier 3 and that they need more training and evidence-based practices for tier 3. So those are great opportunities there. As you're connecting with schools, and after you've done some of that individual work within your PMHCA to think about what's our capacity, how does this fit with our vision, then starting to think about, okay, so now what do we ask schools and school systems to find out what their system already looks like and where might be places that we could plug in. So we'll have a great resource that's coming out soon that gives you ready to use and adapt questions about asking school systems, and even at the state level, about partnerships and teaming, about current mental health work, about supports and services, and about the systems and student population needs. But because I think many folks maybe came to this webinar asking, okay, but Jill, I just want to know where my starting point is. Like, what are some things, who are some folks that I can reach out to? So these questions are helpful both at the district and state level. So I could see folks asking these questions to both groups. What are current ways the school supports youth mental health? As we're thinking more specifically to districts or schools, what teams are there that focus on youth social, emotional, and behavioral well-being? You've got a plethora of acronyms here, but many folks just refer to their teams as MTSS, or response to intervention is your RTI team, or positive behavior interventions and supports, SDL, wellness. And if you're feeling like that's still feeling like alphabet soup, there's plenty of places. We have links to resources at the end if you want to get more information about what those might look like. We've seen school folks who are looking to partner in schools, and specifically pediatric primary care and PMHCAs, by this third question: what can our team do to support you, right? So before we come in with what we might be able to offer, asking what they might want and what they might need. Opportunities to combine efforts. And sometimes schools are moving so fast that there is not even time for them to set up a meeting to be able to meet. But we've seen folks have success saying, can I come and join? Do you have a state level meeting that's happening, or a district meeting that's happening that I might be able to join? We also want to highlight some district contacts. So if you're even just trying to search on the website to find out who is the correct person to connect with, these are different potential titles of folks who might be a good person to reach out with. And I saw folks sharing in the chat, like, making those personal connections has been very effective. So knowing that it takes some time to do some digging and to find that at the state level, thinking about your state Department of Health or mental health, state school nurse consultants, state school-based health alliance, school-based health center group, may be a good point of contact. So lots of inroads for you to think about as places to get started. All right, let me, as we're moving into our next section here, I'll kick it over to Katie and look at additional questions that are coming in the chat. Katie, go ahead.
Absolutely. Thank you so much, John. Yeah, the chat is just on fire with so many great questions and resources, and feel like y'all could probably do this presentation yourselves with all the different resources you're sharing. So we will make sure we save all of that so that everyone can have access. So we wanted to talk a little bit about tailoring PMHCA services to school districts. So we're going to touch on the three big buckets: consultation, resources and referrals, and training, with a little bit more in-depth look at training today. But we wanted to first start talking about consultation, which I think is an area that many PMHCAs are already doing, either with primary care providers or also with the schools. So it's important to think about, consultation can take many different forms, and it's important to consider how consultation is going to build the capacity for those you consult with. And the modality, audience, and the content of the consultation all matter when we're thinking about that. The first thing to consider for a PMHCA who is beginning to do consultation work in the schools is what is actually going to build capacity for that school, for that district, right? There are thousands of schools in your state. So how are you providing consultation in a way that is going to impact the long-term outcomes? And I know that there are many people who are doing this already. So if you are doing consultation in the schools, please share in the chat how you have approached that and how have you seen that working so far. So one of the first considerations is modality of consultation. So is your PMHCA going to have, call-in consultation that is on demand? So school staff can call into sort of like a resource line to get some consulting, or is it going to be scheduled? I know some PMHCAs have had sort of consultation groups that meet weekly and that have more of a regular process. So those are, two things to consider. If you're doing teleconsultation, what is that going to look like? How is that going to be accessed? Are you going to be doing a more individual provider consultation, groups of providers consulting with whole schools or districts? It's important to consider the resources that the PMHCA has and how you're going to use that through these different modalities. It's also important to consider audience. So are you going to be consulting with providers from a community-based organization who is maybe pushing into the school, or consulting with school-based personnel? There might be different needs, different priorities, different backgrounds, trainings, and different policies that may impact the different audience members. And so that's something to consider when providing consultation. Also want to consider, is this at a building or individual school level, or for an entire district? And what are the different considerations there? And again, individual consultation versus the team. How is that going to be tailored? You also want to consider the content of the consultation. So is this going to be a more traditional clinical case consultation where providers might bring in their cases and need expert opinion, or pulling off of each other, or maybe consultation on system level concerns? So overall, how is the school utilizing the mental health services that they have? How are they working with partners in their community? How are they working with primary care providers? Different schools or districts might have different needs. And then maybe you're providing consultation on more specific topics. And so it's providing consultation for different type of clinical concerns, or a topic like bullying, or something maybe that's more specific to schools. So these are just a few considerations when considering moving into consultation in schools. Another area to consider is resources and referrals. So if you're developing resources and you're supporting referrals from the schools, thinking about the school-facing materials. What are some things that you could have? Maybe fact sheets for school personnel, website pages for school teams, databases for local community mental health providers. And we wanted to shout out one of the PMHCAs that is on the call today, Most CPAP from Missouri, because they have a great online hub for school-based audiences, where they can go in and find different resources on different topics, as well as access their other services. So that's just one example of how you can kind of put together resources that are specifically for schools and make sure they're accessible. Thank you so much, Melissa, for dropping that link in the chat. I'm going to throw it back to Jill for training.
Thanks, y'all. Thanks, Katie. Thank you, Melissa. And yes, as you can see, you've got your wealth of expertise right in this community. So another flag to keep using that, make some connections. Feel free to private chat folks and say, hey, can we connect more? I'm really interested in how you're doing that. Love hearing these different pieces coming through. And so now we're going to spend a little more focused time on thinking about training and education for school-based audiences. We'll talk through each of these pieces, building a foundation, thinking about recruiting and engaging participants, what might be different formats, and evaluating the effectiveness. So in all of this work in school mental health and our work in PMHCAs, and of course, as we're thinking about training, we want to spend a lot of time getting started with building our foundation. So thinking about our capacity, thinking about our areas of expertise as a PMHCA, what might be the areas that we really feel like we can lend expertise to the school community, and understanding the school needs and what they see as a gap, an area where we might be able to align, and being very specific about setting training and education goals. So as Laura has mentioned, we've got a couple of resources that are coming out for you. One specifically is a playbook that talks about training and education for PMHCAs for school audiences. And so we pulled some of those things right out of that playbook. And so some example goals here, right? Create multidisciplinary team structure to identify, screen, and assign students to interventions, right? That might be a system development. That topic might be going to your school mental health team and might go to team leaders. You might want to do something different that's more like on a clinical topic, right? So we have some examples there of what system consultation might look like, or you may be thinking that your training goals and topics might be more specific on psychopharmacology or universal mental health screening or a specific mental health clinical topic. And so thinking about what's the goal, what are you hoping to accomplish when you're thinking about your mission, right, is to increase access, increase capability to make sure we're addressing mental health, that you have a goal specific to that, that you have expertise to address it, and that you're making sure you're thinking about your audience. And just a reminder of this big audience, right? That when we're thinking about training, is it one of these groups? Is it some combination of these groups? And I heard some awesome things happening in the chat about combination of audiences, and especially combination of PCPs and school audiences, that PMHCAs just have such an awesome opportunity here to really help to bridge the gap between those groups and to help and we've heard from PCPs that they wish for more opportunities to get to know their school providers, folks who are in SBHCs or directly in the schools. And so training could be an opportunity for that. And so when we're thinking about different training formats, lots of different training formats to think about. So this could be a more didactic professional development session or series. This could be a learning community, and that could include different folks from it could either be specific to school counselors or school psychologists, or could look to do some cross collaboration. As we move up some of that structure of a learning community, thinking about a learning collaborative or community of practice that is perhaps more structured, has more opportunities for folks to really set goals and think about how they're moving forward together. Consultation groups, Katie spoke on that a bit, and we'll highlight more about some awesome ECHO work that has already been happening for that PMHCAs have been leading for connecting to school teams. So for folks who are not as familiar with the ECHO model, it's an all teach, all learn, and the focus of it is ensuring that the right knowledge exists at the right place at the right time, and is somewhat of a learning community collaborative structure that really focuses on knowledge sharing, allowing for some didactic content in addition to that sharing that's happening back and forth. And I'll have to say, this community of practice and sharing, we're seeing dynamite happening right now. And so ways that you can continue to do that and you can carry that forward with your school communities and with your communities who are supporting mental health across the state. So including pediatricians and school-based staff. Awesome work that came out of Maine. They have been leading this work in running a number of echoes. They partnered with folks across the state to think about what the needs were. They spent a lot of time thinking about what are our topics of need. They identified that focusing specifically on school-based health centers and how to support suicide prevention work and that knowledge transfer. And they had many partners across the state, their Northern Light Acadia Hospital, Maine Health, Maine CDC, that they all brought to the table in this work. Similarly, they ran a mental health promotion in the school setting that was delivered through their MCD Global Health. That was a complement, and it was to create a virtual learning environment where their subject matter expertise could help in this mental health promotion range. That is the quickest snapshot of the amazing work that's happening. We really encourage you to go to their website, learn more about it, check it out, and of course, be in contact with them with questions. As you're thinking about any training, we always want you to be thinking about, is this working? How are we evaluating it? And so in that playbook, you'll see additional evaluation questions here: knowledge gains, satisfaction, short and long-term outcomes. And we want you to know that you have these very specific questions that you can take and adapt for your setting. I also wanted to flag that many school systems across the country are increasingly using the SHAPE system to help to guide their school mental health work. This is a free online platform for schools, districts, and states to advance their school mental health quality. There are assessments on there that many school systems are using. If you're thinking about assessment and how are you thinking about assessing the quality and the continuous quality improvement of your work, highly recommend checking out SHAPE, knowing that this is a tool that many folks use in school mental health and that you have the opportunity to potentially help to support and bring as a tool, and everything on there is free. All right, so some quick best practices across all of this work. So start small, right? We've given you the ocean of options here, but think about one option, one place where you can pilot, one person you're going to reach out to, and really think about building this, right? We showed that tree image. I often use tree metaphors as we think about building our systems, but starting small and giving you room to grow. We've seen so much chatter in the chat and couldn't agree more with this need for cross-sector collaboration and really the opportunity here to build that. We've got a great resource that we'll highlight from the American Academy of Pediatrics that also focuses on that. And in everything that you're doing, planning for implementation, support, and sustainability at the very beginning, at your first stages when you're piloting this, thinking about how could we carry this forward? How do we fund it? How do we make sure folks can continue whatever we train on or whatever we support moving forward? And with that, I'm going to do a quick turn to Katie to see any other questions that have come up that we need to address out loud before we roll into lots more resources to head you to the break with.
Let's see. There are some questions about sharing school-facing materials so we don't have to reinvent them. So how can we kind of all collaborate? And I know Laura linked the base camp for the National Network for Child Psychiatric Access Programs, which is a fantastic resource for collaborating with other PMHCAs. I think there was also some questions about transition and rehabilitation counselors, who to consult with if schools don't have a prescriber associated with them. So a couple other questions in the chat that if we're not able to answer today, hopefully we can kind of send out a summary afterwards.
Absolutely. Tons of great information. Thank you for connecting those pieces and some of those more specific questions. We will absolutely look to send some additional follow-up, and please feel free. You'll see contact information for all of us at the end here. Please feel very encouraged to reach out to our School-Based Health Alliance team and of course our National Center team. So that's a perfect segue into ways you can keep being connected and learning more. I just wanted to flag about our National Center for School and Mental Health. We've got lots of resources on our website at schoolmentalhealth.org, and I mentioned the SHAPE system. We encourage you to get connected with us. It has been so great to meet so many folks. And if you are saying, gosh, I really would love to be immersed in this and learn what folks are doing across the country, we just wanted to flag that we're hosting our conference in New Orleans, where folks from across the country will be coming together to talk about their school mental health models and work that they're doing. You can check that out on our website. We will be, of course, you'll have access to the slides, and here are just our emails, and I'm happy to drop those into the chat as well. We highlighted a number of great resources in here. So if you're saying I need a quick, more information here on comprehensive school mental health, these three are our go-to ones that we will drop in the chat, and you'll of course have linked to. And with that, I want to thank you so much for being with us today and for taking the time to think about this. We look forward to continuing to being connected. And I will go ahead and turn it over to Laura, who's going to close us out and share some more great resources.
Thank you, Jill and Katie. That was amazing how much you were able to provide in the short time we had together. And I can't echo more the importance of this cross-sector collaboration and these partnerships. The National Center for School Mental Health has been a longtime partner of the School-Based Health Alliance. And by definition, the PMHCAs are a cross-sector collaboration. And so you'll see now a few resources that represent these partnerships and hopefully can help guide you as you explore these new territories for your programs. So coming soon from the School-Based Health Alliance, we have some amazing documents. These will be ready toward the end of September. One of them is directly aligned with what two of them actually directly aligned with what you heard today. So that's the PMHCA expansion into school settings, guidelines and considerations, as well as a training and education playbook. And then we will also have a expansive document on collaboration between PMHCA and SBHCs, lessons from the field, really highlighting the natural partnership between these two entities. Again, all of these should be coming out in September. So keep your eye out on either the PMHCA listserv or the School-Based Health Alliance Digest for those. 2 more webinars. One of them is focused on the topic of HIPAA and FERPA, which I saw come up in the chat today on September 14th. Again, you can register with the School-Based Health Alliance, as well as our 3rd of 3 webinars on September 21st, which is again highlighting the lessons from the field between PMHCAs and school-based health centers. And the National Network for Child Psychiatry Access Programs, as many of you know, has a global, very large base camp with, I believe, hundreds of participants and 2 smaller base camps, one focusing on school-based health centers and one focusing on schools. So in response to today's content and today's work, I'd encourage you to look at the Basecamp on school the school consultation group that was put in the chat, and here's a little bit more information on it on this slide. And then to stay connected to the School-Based Health Alliance, you can follow us on social media. You can subscribe to bi-weekly newsletter if you haven't already. So here's information on that. And next slide. And this is just our final thank you slide. Please feel free to reach out to me if you have questions about the PMHCA initiative or the School-Based Health Alliance as well. Michaela Riven has her information here. We are so pleased to have been able to do this today and have such a broad audience. And I do think today's chat and the simultaneous conversation and collaboration that was happening is a real testament to the interest in this topic, the urgency of children's mental health, and the great potential for all of you to work together to make a difference at this time of emerging crisis, but hopefully also emerging partnerships and opportunities. So thank you again, Jill and Katie. And I think we can say goodbye and enjoy the rest of your day.